Hello guys, I am Vishnu. So as you saw in the past video that we had uploaded in YouTube, it was part 1 about drug of choice for specific microbial infections. So since this is a big presentation, we will be continuing with the part 2 today. There will be more parts also which will be uploaded in future videos. So to stay tuned to that, do share and subscribe to our channel for further updates. So in the part 1, we talked about the mission of our channel, a special disclaimer. So to select a drug of choice, which are the different things or which are the different factors that influence in the same. We talked about that. We talked about culture report analysis, how important it is. We talked about the importance of healthcare professional, especially in the antimicrobial stewardship field, the role of a clinical pharmacist, the role of a physician, and the role of a microbiologist, and definitely about risk versus benefit ratio analysis. Today, we will be talking about the drug of choice. So we already talked about carbapenems. They are drug of choice for which kind of infections? We talked about penicillin G. Then for drug of choice for amoebial infections. The voriconazole is drug of choice for selected conditions. Metronidazole is drug of choice for selected conditions. And then last we came to doxycycline. So the next that we are going to talk about is babesiosis. So this is actually not a very common disease here, but this is just for a generalized perspective. This is actually a disease which is caused by microscopic parasites. It is a parasitic disease. They usually damage the RBCs. So from here, you can actually gain a practical knowledge. If somebody is already suffering from anemia, or if somebody is suffering from hemolytic anemia, or their RBC count or hemoglobin count is low, in that condition, this infection can be more deadly or more severe for those patients. And it has been seen in some cases that if this particular condition becomes very severe, then it can lead to heart failure also. And this is usually spread by certain ticks. These ticks are actually some organisms. So in this condition, the drug of choice is a combination therapy. It is atovaquone plus azithromycin combination. Azithromycin, you know, it is a macrolide antibiotic, and atovaquone is an anti-malarial agent. So this combination is usually indicated for babesiosis. Now we come to azithromycin. So in which condition is it the drug of choice? So already we said it is babesiosis in combination with atovaquone. Then it is also given in a sexually transmitted disease which is known as chancroid. So this is a very notorious STD. And HIV has also been linked to this particular condition. It is caused by Haemophilus ducreyi. It is also the drug of choice for Legionella infections, Mycoplasma pneumoniae, chlamydial infections, and cholera in pregnancy, because azithromycin is safe in pregnancy, and Campylobacter infections also. So azithromycin is a macrolide antibiotic. It can be used in these conditions. For example, you are having a burn. So definitely when you are having a burn injury, the skin gets exposed. So if you are having a blister or burn or something, your skin gets exposed. And definitely there is a high risk of getting infections because the skin gets exposed. So to prevent that, the drug of choice is silver sulfadiazine. So this is actually, sulfadiazine is a sulfonamide antibiotic. The one thing that you need to understand about sulfadiazine is that sulfadiazine does not treat infections due to burns. So this is actually used as a preventive measure. It does not directly treat a documented infection due to burns. Now we come to erythromycin. Erythromycin is the drug of choice for diphtheria. So you can see it on the left-hand side, the organism, Corynebacterium diphtheriae. So this is also a very notorious disease, but we usually have a vaccine, so it is easily preventable. Then there is something called pertussis. Pertussis is also known as whooping cough. It is caused by Bordetella pertussis. So erythromycin is the drug of choice if there is an infection due to these organisms. So erythromycin is a macrolide antibiotic. Now we come to fluconazole. Fluconazole is usually used very commonly, especially in immunocompromised patients also, and it is an antifungal agent as well. So fluconazole is the drug of choice for candida infections. So you can see it on the right-hand side, candida albicans. This is very common, candida albicans. And also coccidiodal meningitis. So coccidioides immitis. So coccidioides are actually group of fungus. So they can also lead to meningitis, inflammation of the meninges in the brain. So in that condition also we can give fluconazole, which is the drug of choice. Drug of choice for cestode infection. So cestodes actually refer to worms. So please remember that cestodes refer to worms. So albendazole is the drug of choice for a particular variety, and praziquantel is a drug of choice for a particular variety of cestodes. So if it is Taenia solium, that can cause neurocysticercosis. Neurocysticercosis is actually a severe infection in which the worm attacks the brain tissue as well. And if it is due to echinococcus, in that condition, we can give albendazole. If it is Taenia saginata, H. nana, D. latum, and Taenia solium, especially the intestinal infection, in that condition, the drug of choice is praziquantel. So cestodes are of different types. Depending on which cestode it is, the drug of choice has been mentioned here. Then there is a condition called Chagas disease. So it is also known as American trypanosomiasis. It is actually caused by an organism known as Trypanosoma cruzi. So this is actually spread by a bug, which has been seen on the right-hand side. And this is also very dangerous. It has also been linked to very chronic conditions, and if it is not treated immediately, the antimicrobial of choice for Chagas disease is benznidazole. So benznidazole is used against Trypanosoma cruzi. This is very, very interesting, and this is also a very dangerous infection. And this usually happens when antimicrobials are not used properly. I would like to describe about this. That is why rational use of antimicrobials or antimicrobial stewardship is so important. Whenever you always remember that inside your body, there are a lot of beneficial organisms which promote different physiological functions of your body. When you are using a broad spectrum antibiotic, in the name itself, it is written, when you are using a broad spectrum antibiotic, it not only kills the pathogenic organism, but it also kills the normal organisms that are required by your body. So when you are using it for a long time, it can lead to immunosuppression because the healthy bacteria in your body actually promote immunity as well. So what happens when your immunity becomes low? Outside pathogenic organisms can colonize inside your body and create severe infections. So there is one kind of bacteria which is known as Clostridioides difficile. This is a very dangerous bacteria, and it causes one of the most dangerous types of diarrhea, which can be fatal if not treated properly. So this usually occurs due to disruption of normal healthy bacteria in the colon. So this mainly occurs as a result of broad spectrum antibiotics. Clindamycin also has a very huge risk of causing this infection, and along with many other antimicrobials. Broad spectrum antibiotics not only destroy infectious pathogens, but they also prove deadly for beneficial bacteria in our body. So the symptoms can range from diarrhea to life-threatening damage to the colon. So if you are having Clostridioides difficile infection, the drug of choice is oral vancomycin. So please remember, vancomycin is usually given parenterally. But if it is a Clostridioides difficile infection, vancomycin can be given orally. Vancomycin is also given. Actually, that is the drug of choice. There are other antimicrobials which can be used. One example is fidaxomicin. We can use metronidazole also, and definitely rifaximin. but the drug of choice is oral vancomycin. So here you can see the image of Clostridioides difficile. Now we come to amphotericin-B. So amphotericin-B is the drug of choice for cryptococcal infections, especially cryptococcal meningitis. Kala azar. So Kala azar is actually a form of leishmaniasis. It is caused by Leishmania donovani. Mucormycosis, it is a kind of fungal infection. Primary amoebic meningoencephalitis. So this is actually very dangerous. If this is actually a kind of amoebal infection, Naegleria infection. It's also known as Naegleria because it's actually caused by Naegleria species, and definitely for systemic fungal infections, depending on the culture report analysis. And definitely amphotericin-B is not exactly used directly unless and until it is heavily required because it has its own risk of side effects. But definitely for these conditions that are mentioned here, amphotericin-B is definitely the drug of choice. So here you can see a organism that is called Cryptosporidium. So if you are having an infection due to Cryptosporidium, then the drug of choice is nitazoxanide. So nitazoxanide can be used. If you have dermatophytosis, so dermatophytosis can be of different types. You may have heard of it. Tinea capitis, Tinea cruris, Tinea pedis. So these are all fungal infections that can happen in different parts of the body. It has been shown in the picture here. So for all dermatophytes except Tinea capitis, the drug of choice is terbinafine, but then it has its own risk of side effects as well. So there are better alternatives. But the drug of choice is considered to be terbinafine. And if it is Tinea capitis infection, then griseofulvin is the drug of choice. Now, when we come to diarrhea, the drug of choice is fluoroquinolones. So definitely there are a lot of fluoroquinolones which are used in combination with lactobacillus or maybe even anthelmintic. For example, norfloxacin plus tinidazole combination or ofloxacin plus tinidazole combination. So like that we have ciprofloxacin plus ornidazole combination. So like that combinations come. So fluoroquinolones are the drug of choice for diarrhea. But please remember, this is empirical in nature. Empirical means you are having acute diarrhea, but we don't know what is exactly the cause. So empirically, we can use fluoroquinolones, but that diarrhea can be due to various reasons. It can be the side effect of a medication also. It can be due to the clinical condition of the patient, maybe due to some other comorbidity. It can be due to a worm infection also, or it can be due to some other bacteria in which fluoroquinolones are ineffective. So fluoroquinolones we give empirically, but then we have to understand what is the cause of diarrhea, and based on that, we should go for targeted therapy. Now we come to ceftriaxone. So this is the last antimicrobial that we are going to discuss today. And then the rest we will continue for the remaining days. Ceftriaxone is the drug of choice for a lot of conditions. And you know very well, ceftriaxone is a very commonly used medicine. So ceftriaxone is the drug of choice for E. coli infection, gonococcal infection, Hackett organisms. So this is Hackett is actually a mnemonic. It consists of 5 different types of organisms: Haemophilus aggregatibacter, Cardiobacterium hominis, Eikenella corrodens, and Kingella species. So like that, there are 5 organisms, and those collectively are known as Hackett organisms, and ceftriaxone is the drug of choice. It can be used for Haemophilus influenza meningitis. It is a drug of choice for meningococcal meningitis. It can be used for Klebsiella infections also. It can be used for Providentia infections also. Salmonella infection, especially in typhoid, we can use ceftriaxone. Acute bacterial meningitis as a part of empirical therapy. Then we have to find out the CSF culture, or we have to find out the culture report, and based on that, we have to use the appropriate antibiotic. If you are having meningitis with basilar skull fracture, so if there is a basilar skull fracture, there is a leakage of fluid into the brain, and that can actually cause colonization of bacteria. So in that kind of meningitis also ceftriaxone can be given. In brain abscess, subdural empyema. Subdural space, you know very well, it's a part of the brain itself. We have the dura mater, we have the pia mater, and we have the arachnoid. And definitely in typhoid also ceftriaxone can be given. Now, please remember that whatever organisms we have mentioned here, especially E. coli, especially Salmonella, and Providentia, Haemophilus influenza, and Klebsiella, in all these conditions, we also have to look at the culture report. What does the culture report say? Because general theory states that ceftriaxone is effective against them. But in an individual's culture report, it may come out to be resistant. So in that condition, what is the analysis of the culture report? And based on that, we may have to switch over to some other antimicrobial, which is sensitive or which can be efficacious against this organism. So blindly, we should not follow ceftriaxone. We should first take the culture, do the analysis. Once the report comes, then we have to see whether the patient is having a particular infection and what is the resistance or sensitivity status. Ceftriaxone is a third generation parenteral cephalosporin, and ceftriaxone has a very big speciality. Ceftriaxone and cefoperazone are the only cephalosporins which are eliminated through fecus because they have hepatic elimination. They are excreted through bile. And that is why the dose of ceftriaxone and cefoperazone should be adjusted in severe liver conditions because they are eliminated through bile. So in severe liver conditions or in liver insufficiency, we have to adjust the dose of ceftriaxone and cefoperazone. All the other cephalosporins are eliminated through urine. That means renal elimination. So if a patient is having renal dysfunction, we may have to adjust the dose of other cephalosporins. But ceftriaxone and cefoperazone can be safely used in renal failure because they are not eliminated, or they are very little, negligible, almost very little, they are eliminated through urine. So this is just a specialty of ceftriaxone. I thought that I will share with you. So these are some of the organisms or some of the medicines and in which condition they are drug of choice for. We will come with part 3 tomorrow. In that you will see many other conditions, many other infections, and what are the respective antimicrobial of choice and what are interesting features about them. So thank you so much for viewing this. If you find this productive, please do share and subscribe to our channel, and do share this information to maximum people so that it may help your theoretical as well as practical knowledge. Thank you so much for listening.